Durant près de 15 ans, j'ai travaillé auprès des enfants atteints de cancer en qualité de conteuse. Alors qu'un sourire peut tant dire, j'avais l'obligation de porter ce masque. Imaginez le sentiment d'exclusion et de rejet que cela peut générer. Alors je rêvais de réaliser un masque transparent qui permettrait d'humaniser les visages, de voir les émotions et de sourire. C'est alors que j'ai rencontré Sacha et l'utopie pouvait se réaliser.
When my friend Diane told me about these young patients and a transparent mask, I thought, what a great idea. At that time, I also remember my kids and nephew at the hospitals and the flu epidemic with all these people, wearing masks. And I could see the potential of having a transparent mask. Now, how to proceed in order to transform this idea into a real transparent mask, and who could do it? And this is where friendship again helped me, or helped us. Thierry, an old friend from university, had the perfect profile.
For the Hello Mask project, we first tried to identify who would be the main beneficiaries of a transparent mask. It was the hospitalized children, of course, but also the elderly, and actually all the healthcare workers whose relationship with the patients would be greatly improved. The first element of validation came when the Hello Mask project won the first prize of the Deliofarm in Artist Challenge.
The Essential Tech Center aims to develop technologies against poverty and vulnerability. We have been confronted with the need for protective equipment for people coming back from the Ebola context. And we found that the ability to empathize with the people directly was very important. In order to achieve the technological parts of this project, we decided to reach out to the lab of Professor Rossi in St. Gallen and his team.
Creating a transparent mask required the development of a completely new membrane. Of course, we know how to produce homogeneous transparent materials, such as glasses or plastics. So the scientific challenge was to introduce pores into the materials to allow for air permeability, filtration efficiency, and transparency. The problem to solve was that by introducing pores into this material, it starts to scatter the light, becoming opaque.
A transparent medical mask is, from a regulatory point of view, a medical device of Class 1. And as such, it needs to fulfill certain standards. This involves a defined bacterial filtration efficiency, air permeability, and resistance to liquid splashes.
The first step was to identify the best raw materials. Our guidelines for the selection were, beside transparency, low cost and minimal environmental impact. We finally selected a method called electrospinning, a relatively new process in the industrial field. Using this method, we were able to produce porous and semi-transparent materials composed of micro and nanofibers. Our last achievement was to develop a post-process method that increases both the transparency and the resistance of this new material.
We also received many enthusiastic feedbacks from patients, from nurses and hospitals, including the Geneva University Hospitals, which has been following the project from the beginning.
With Thierry, we started to fundraise for this research project, and we were fortunate. Numerous foundations responded positively, and among them, the Gebert Rüf Stiftung. The Gebert Rüf was essential not only by the amount that they provided, but also because they are one of the major Swiss innovation foundations supporting scientific projects and challenging ideas.
We were able to develop a new type of transparent material. Its optimization is now in progress. We need to find the right balance between the maximum possible transparency and the functional properties. For us, the next steps are the development of large-scale manufacturing process for the material, the pilot production of mask prototypes, the regulatory registration of the mask and its evaluation in a clinical setting. A patent process is ongoing to protect our invention, and the creation of a startup company is now planned for the marketing of the new mask.